Media. I'm Bob Beck. COVID-19 has made its impact on Wyoming communities, but one thing that doesn't seem talked about enough is the effect a pandemic can have on mental health. Wyoming remains one of the highest states in the nation for suicides per capita, and many rural communities face extreme difficulty finding support in a mental health crisis. Over the course of our 60 minutes together, we will hear from people who study and advocate for mental health in a variety of ways. We'll discuss how the current pandemic has taken its toll on an issue that is already prevalent in Wyoming. The goal of this conversation, of course, is to educate all of us on where to find support for at-risk people of all ages. Panelists will answer general questions about COVID's impact on trauma, depression, and addiction. Today's discussion is the first of 3 virtual town halls Wyoming Public Media will be hosting that deals with COVID-19. We will hear from our experts, and we would also like you to participate. The way you can do that is you can submit a question on our Facebook comment section. So let's introduce our guests. Dr. David Martirano is the Assistant Medical Director and Director of Adult Psychiatric Services at the Wyoming Behavioral Institute. Dr. Tess Kilwine is a clinical psychologist here at the University of Wyoming, where she's both the trauma specialist and director of clinical training. Dr. Julio Briones is a licensed psychologist at the University of Wyoming Counseling Center, specializing in suicide prevention. And Dr. Cynthia Hartung is professor of psychology and the director of the Psychology Center here at the University of Wyoming. Tess, get ready. We're going to start with you. I want to ask all of our panelists this question, but Tess, to begin, what's the biggest COVID-19 mental health impact that you've seen in your area of experience?
Sure. I would say across the board, and this isn't unique to COVID, this is any kind of crisis, any pandemic, any major event that might occur, is anxiety. So there's anxiety about, how will my life change? How will I be impacted? How will my family be impacted? Worry about the future, worry about decisions that one might make that might impact the people around them. So we're going to see an increase in mental health symptoms across the board: depression, anxiety, even thoughts about suicide. With a crisis like this, you're going to see a lot of the symptoms of depression and anxiety, and especially the anxiety about the future of what comes next. When will this be over? Will it be over? Will I make it through it?
David?
Well, I agree with Dr. Kilwine. First of all, the challenges really that I see are a lot more depression, a lot more substance abuse as well. So, working in an inpatient setting, a lot at WBI, we see people who were unemployed for substantial periods of time and receiving benefits. And, the lockdown also resulted in people not really being able to go many places, but they did keep liquor stores open. So as a result, there were a tremendous number of people who relapsed after extended periods of abstinence and sobriety. So that was a big challenge for us.
Julio.
To echo what everyone said so far, increases in anxiety, depression, and while there was an increase in suicide ideation, thankfully the number of suicides actually decreased during this 2019 to 2020 nationally, which is useful information, which is good news. I just wanted to share that briefly. Thanks.
Cynthia?
Yeah, I agree with everything that everyone else has said. The other thing that I would add is that I think that one way to think about this is that we might all have some vulnerabilities in terms of our mental health. So, some people might be on the anxiety spectrum, or other people on the depression spectrum, other people on the substance use spectrum. And those are things that they're susceptible to. And so my thought is that what we're seeing is that whatever the thing is that you're susceptible to might be exacerbated during this time. And so, our tendencies, if we're someone that tends to be anxious, then we might be more anxious. If we tend to be depressed, we might be more depressed. If we're already using substances to cope, we might be doing that to even a greater degree. So that's what I've observed.
Again, if you have a question for any of our guests or the group, just simply put your question in the comment section and we'll get to them. You were just talking about this, Julio. I thought I would circle back around. So the current suicide rates in Wyoming, what are we seeing, and how many of those are actually can we connect with COVID-19, do you think?
Oh, thanks for the question. So the rate of suicide in Wyoming continues to rise. It rose from 2019 to 2020. The risk factors and warning signs that you would see didn't change a whole lot with COVID. However, a couple of prominent things did come up. Lack of access to affordable housing, job loss, financial security distress. When those things occur, a person can begin to feel depressed, then trapped, hopeless, and that leads to ideation of suicide and attempts of suicide. In addition to lack of access to effective treatments for prevention of suicide, like cognitive behavioral therapy, dialectical behavior therapy, and in some cases, access to lethal means when at risk for suicide as well.
Anyone else want to comment on what maybe they've seen in that area?
In terms of suicide rate or risk factors, I'm not sure what you mean by comment on that.
How you've seen the connection with suicide and COVID-19?
I haven't seen a direct connection. I've seen a lot more depression in youth, school-age kids, different kids who weren't necessarily what I would have stratified as that very high-risk group before. Changes in socialization patterns have resulted in changes in their mental health. And I think that children who were doing okay in a structured setting, when you had all these interruptions and changes in fragmentation, especially if there were more problems in the home, those kids tended to fare worse than you would have expected, because school actually provides a degree of structure for those kids. And when they're not in that structured setting, that's caused a decompensation in a mental health fashion.
Anyone else on that? Great. David, staying with you, what kind of an increase have we seen in addictions? Did the lockdown result in an increase in addictions and counseling needs?
Yeah. So nationally, there were rises in opioid use, opioid overdose, particularly alcohol use, and those go into the 50% range increases. Broken down by state, they varied between 17 and 48%, I think. So that was a big change. In terms of why, I think the why is pretty apparent. In terms, if you're not working and you don't have to get up for work, and you tie one on one night and there's no consequence, you tie one on the next night, there's no consequence. Eventually, life isn't reminding you. And if checks are coming in during those periods of time, and then when the checks ran out, that was a really big time for us in terms of a lot of people really hitting despair. And then there's a second group, which are all the first responders, providers, nurses, physicians, who had opportunities to make tons of money at times, especially nurses who were able to triple their income, but were working incredibly hard and stressful jobs. Really, it had a tremendous impact on that local group of people's mental health. And then all of the associated social stresses around vaccines, mandates, all these other things now have kind of fragmented people's workplace integrity as well. And that's caused a lot of people to question their jobs. I know several nurses who just quit. And after 10, 20 years on the job, just said, nope, not going to do it anymore. And that was right after working even harder and harder. So it's also impacted our first responders, in a variety of different ways. This was a very tough week in Casper for people on the front lines as well.
Going back to addiction, can I follow up on something? I was curious about this, and I wonder if there was a cause and effect. One of the first things the governor did was allow us to go to our favorite establishments and bring a lot of our alcohol home, or even get alcohol deliveries that we'd never seen in the fact. Was there any problem with that you saw? Did it come back to bite us in any way?
I don't think that was the one that bit us, to be honest. I really don't. I think, and I don't, I'm not a huge fan of alcohol as a rule, but I'm also not a prohibitionist. But I don't think that change in access were the groups that were really at highest risk. I think that It was just people who, I haven't seen anyone who said all of a sudden they started delivering it to my house. Maybe 2 or 3 patients of mine who are disabled, who also have substance use problems.
Okay. Anybody else want to comment on any of those things?
Yeah, I just want to throw in that we don't even know the full extent of how this might impact people who have previous addiction in their past, who may go on to develop. Because what we know, and this is not unique to COVID, is that 80 to 90% of people who experience substance use issues don't access treatment. They don't make it into treatment. They never end up in the office of one of us. And so we just don't know. And I think that's a bit scary in that the longer people are in isolation, the longer people are coping with anxiety and depression, the longer that this goes on, we're going to continue to see this increase. And I don't know if or when we'll ever truly see the impact of it in a professional sphere.
Testing with you, COVID has made its impact on everyone in a variety of ways. What thoughts do you have about the collective trauma communities are experiencing?
Sure. Yeah, collective trauma refers really to the reactions to traumatic events that affect an entire group or society. So essentially how we collectively remember an adverse event, similar to what we might observe after, times of war, mass shootings, natural disasters. So it can look a bit different than individual trauma, and people are much more likely to dismiss it if they consider themselves not personally impacted. But in reality, everyone has been impacted by this pandemic in some way. And so if we look at how that might show up in people's lives, fear, vulnerability, people might question their own identities, their relationships with others, and even sort of the future and safety of our society as a whole. So this isn't to say that our entire society will go on to develop post-traumatic stress disorder. While a subset of the population might, and particularly those who are most closely impacted by medical trauma, trauma and PTSD are not the same thing, but we're still going to see some trauma reactions like confusion, anger, hypervigilance. And I think above all, it's important to remember that we're all going through this. And so when you dismiss the reality of the pandemic, when you're unkind to a neighbor or service worker, you're sort of capitalizing on that collective trauma that everyone's experiencing. So we could all use a bit of a reminder that we're not alone, and sometimes we should step away from social media, especially when that contains information, focus on our health, our whole body, our whole mind health, and make time for the fun and community when you can. And really in a collective trauma sense, it's not over until we all as a collective commit to prioritizing the health and safety of our entire society, of the entire group, over our own individual discomforts. And it may not be over for a while. So collective trauma is very real, but so is collective resilience and healing and community. And that's the direction that we should be going.
If I could just add something to what Dr. Kilwine was saying. The interesting anniversary that happened a few weeks back with 9/11 and 9/12, many people talked about the collective resilience of people on 9/12 and how the country unified on that day. We haven't had the same kind of coalescing moment with coronavirus. It's been very divisive due to changes in how our lives are with social media, misinformation, disinformation, really dividing us instead of everybody agreeing on what the enemy is. The enemy is the virus, that's clear. And I don't think people look at it that way. I think there are large groups of people who don't feel that way. As a result, we don't have that same feeling of being united in a cause. For a little while we did. In the early days of the lockdown, I think there was kind of a spirit of cooperativity that was evolving in large portions of the population and maybe uniting behind healthcare workers and first responders to a degree. I don't feel like that's really there as much anymore. And I don't think people really have an identified cause or objective. And I think that's why we're struggling so much.
Well, probably part of that, wouldn't you think, had something to do with you had a very divisive election and certainly an election outcome, and things became a little more politicized. Wouldn't that have played a role?
I don't think a little bit would be would be the word I would use in these circumstances. I don't know what your definition of a lot would be, but I know that it was definitely a huge challenge in terms of how both parties attempted to leverage it, and with tragic consequences. Thousands of tens of thousands of lives lost. I see people still dying every day because of misinformation, and that's really hard as a doctor. I also work at Wyoming Medical Center. I'm in the ICU a lot, and it definitely is hard to see people fighting for their lives who really weren't given correct data to make a good decision.
Cynthia, I'd like to ask you a little bit about telehealth, if I can, and just, that's been a tool for rural Wyoming, actually, for maybe more than people realized. But over the last few years, we've certainly seen more counseling services, and that was a big part of helping get a number of people through this last year. How has the need to offer telemedicine changed over the last year? And do you see this as something that might be one of these things that could be a positive thing for us?
Yeah, so there's a number of issues there. I mean, one of the issues is that in general, mental health services are very, very underutilized. So, we think that about 20%, and this is before COVID, about 20% of the population suffers from a mental health disorder, and only about 20% of them ever get any treatment. And so mental health services are very underutilized, and telehealth is a way to increase utilization and make it more available in communities where it's not as easily accessible. We have been using it for a long time, but I think one of the positive impacts of this situation is that a lot of people who weren't using it before have learned how to use it effectively now. I think, though, on the flip side of that we still need to emphasize quality mental health services. And so for a lot of mental health disorders, we need to use some very specialized treatments in order to provide, evidence-based services. And so for some of these, really widely available telemental health services, I think the emphasis on quality is not necessarily there. So I think, those are some of the issues that I've observed. And Tess, you probably have a few things to add to that.
Sure. Yeah, I think you alluded to it in an important way, in that there's pros and cons, and that if you increase access and we increase the services that are provided over telehealth, what it does in a good sense is that you can access a provider maybe across the state or even in another state who has a specialty with what you're presenting with. And in a rural state like Wyoming, we have very limited access to specialty services in terms of addiction, trauma, certain personality disorders, eating disorders, more of these severe issues. When you are restricted to finding a provider only in your physical location, that could really limit your ability. So what telehealth has done is it's expanded the access to providers that are really competent in a certain level of care. On the flip side, what it has created is, as we alluded to, a number of these online platforms that the provider may not necessarily have a competency in your area. They may not necessarily have any familiarity with the location that you're living in, the specific needs that you might have. Some of those services are delivering telehealth via text message, email, phone calls, in comparison to what you might find from a local provider who's providing it over video. We have really good evidence for video platform counseling, delivering psychological services through video. We do have evidence on how that can be done effectively. We don't have any evidence on these platforms that offer text messages, emails, different alternatives to services. So it might mean you make contact with a provider sooner, more often, but what is the quality of that contact? What is the likelihood that that's actually going to reduce the severity of the concerns in your life?
And I'll just add to that, Bob, if it's okay. I just want to add that the other thing that the evidence that Tess is talking about, like this really good evidence for the effectiveness of providing telehealth by video, that doesn't extend to psychological assessments. And it also doesn't necessarily extend to psychotherapy with children. So for example, it's probably really hard to do therapy, with a child who has anxiety or autism or ADHD via telehealth. So we don't have as much evidence there, and we certainly haven't figured out how to adapt. When I do an assessment for someone to see if they have ADHD or learning disabilities, we don't have good methods for adapting IQ and achievement testing to telehealth.
Well, we, as I mentioned, would love to hear from some of our viewers and listeners. And the way you can ask a question is by asking it through the comments section of our Facebook page. But let's take one. This is from Melissa Bates on Facebook. Are we getting any data on mental health issues, including suicide among our elderly population who have been most isolated by COVID? And how are we helping these folks? Julio, do you want to take a run at that one?
Sure, thanks. And suicide amongst elderly folks 65 plus has frequently been on the higher side, particularly for people that are from communities that have been marginalized. So while we do have lots of access to mental health providers in Wyoming, we have very, very few for psychologists, therapists, social workers, counselors, what have you, of color. I believe we have maybe one Black clinician in this entire state, which is woefully underserving a population of Black folks in Wyoming, particularly for the elderly folks. There is not a whole lot of connection that's being made right now to provide value to people that are elderly with knowledge that they have. So we need to do a better job about using the knowledge of our elderly population to educate those in the community about how they can stay well, or ways that we can try to work with these folks so they can become peer specialists or something of that nature, to use their knowledge to outreach to other people in Wyoming who may not have connection. So the risk factors and warning signs for suicide has not changed for the elderly population, even with COVID. Isolation is becoming more pronounced, specifically in a couple of instances you can probably read here in Wyoming, where different centers had to close down because of COVID concerns and things like that. So that will lead to further isolation. We can do a lot better with outreach, not only towards folks that are a bit older, but also allowing them to advocate and educate us on how to best support them too.
One of the things I would hear from older folks is, the isolation, especially not access to their children or other family members, and them being alone. Is that something that constantly came up, and how are we helping people maybe get through that and deal with that? Because I think some of that is continuing. Can anybody jump on that?
I'll just add a little bit to that. One of the things that I've observed as a clinical psychologist and also a middle-aged person is that amongst my peers, a lot of us have elderly parents. And I think that, in the very beginning of the pandemic, and probably still continuing, a lot of people sort of took this attitude like, I don't want to go visit my parents because I don't want to risk getting them sick with COVID. I think that one of the things that's really, really hard to weigh there is, what if it turns out that that's the last year of a person's life or last 2 years of a person's life? And so, we as adult children and caregivers are sort of making this decision that we're going to protect our parents from COVID by not, risking that exposure, but at the same time, it's increasing isolation. And I don't know that there's a good answer to that, but I think that a lot of older adults would say, I might rather take the risk that I'm going to get COVID than not get to see my grandkids or my children for a year or 2 years, as it's turning out to be. So I just think we have a real dilemma there that is really hard to balance.
I adding on to that a bit in some different directions, there's a distribution of this population, because for some people it became an opportunity to become more tech savvy and really connect through different means. Earlier there was mention of doing assessments of children via Zoom. And if you look at kind of the difference in how much more facile children are being educated over Zoom a year later than they were, in 2019, it's really changed. For the more tech savvy and educable older people who don't have dementia, people who are still intact cognitively, a lot of them have embraced the technology and they're finding new ways to get connected. I know several people in their 80s who have reconnected with friends across the country who they weren't going to visit anyway, who now all of a sudden, because of the extra time, have time to, like, they play games on Zoom, they have a glass of wine and sit back and relax over Zoom. So it's changed. And also in Wyoming, we have a group of people who are fairly isolated most of the time anyway. You know, there are our rural people who really didn't change their life very much because of COVID. And they just kept living the life they were living before that. But for people who tended to travel and people who had a budget to travel, it was huge setbacks if they planned on taking a once in a lifetime trip or attending their child's wedding. And all those losses add up in terms of quality of life decrements that are significant and have had lasting impact on our society and persist and have been amplified to some degree over the past 6 months as the Delta variant has spread.
I think that's a really great point, David, too, though, that you know, some of us have reconnected and found ways to introduce technology to these older adults, and that might have a lasting positive impact.
I hope so. It'd be nice if some positives come out of all of this.
How important is it going forward? You know, I have read that there are people that picked up some unhealthy habits last year and maybe weren't getting the fitness that was necessary. How important is it that people maybe take a look at their lifestyle and maybe start addressing some healthy habits? Is that something that would be useful to folks as we move forward in trying to recover from some of this?
So as an author of a chapter on smoking cessation and the fact that smoking is a huge problem in general, I think that if there's one controllable risk factor that people should today take the opportunity to address, it would be, if you smoke, today would be a great day to quit. A month from now would be a great day to quit. Get help quitting and stop smoking, because it's the difference even in 3 months of smoking cessation on your pulmonary function and your chances of ending up intubated will go way down. So I don't have exact data on that, but I can guarantee you on that one that if you stop smoking today and you get COVID 3 months from now, you're going to do a lot better than if you don't. So the single biggest one I would say is stop smoking.
And I want to throw in there, I'm a bit more of a harm reductionist, whereas I'm like, you know, I'd rather you be using than, you know, causing harm to yourself and things like that. But I think it's important for us to keep in mind that quitting is really challenging right now. So when we're more depressed, when we're more anxious, when we're grieving, when we're isolated, when we don't have access to a lot of traditional opportunities to improve our health, to go to the gym, to meet with our communities, it's true that quitting now would be good, right? And it would benefit your health. And quitting is harder than ever right now when people are in isolation and they don't have access to a lot of alternative coping mechanisms that are necessary in order to have a successful quit. So just wanted to throw that in.
Again, if you have a question for our group here, you can ask it on Facebook in the comments section. And here's a question from Andrea Shipley on Facebook. Given the recent growth, what do you all think the next steps are to increase access to quality telemental health in Wyoming? Would like to handle that.
The number of providers. So we don't have an excess number of licensed providers. You know, even though we have some real quality people, they're usually saturated. You know, I don't have the ability to add people to my practice. I would assume that most of the people in this feel the same way. It's not that I can see more patients because of telemedicine. Sometimes it allows me to provide expertise somewhere remote, but that's always at the cost of something local. And we have a real dearth of pure provider hours throughout Wyoming, and that's an ongoing issue. So I would say that's the single biggest factor to expanding it further. Licensing people out of state is great, and that does happen, but it doesn't happen fast enough, and we don't have enough.
And I would add, speaking with your legislatures, advocating for insurance expansion, Medicaid expansion, because telehealth is great, but is it covered by your insurance? And so what we're finding is that during the pandemic, a lot of insurance companies expanded their reimbursement rates for psychologists specifically. I can't speak to other licensures, where they would cover telehealth during that time. But as soon as the emergency order expires, they're no longer covering some telehealth services in different states for different providers. So what that means is telehealth is not going away. It's not going to be the new norm, but it's going to be a service that is more appropriate and more accessible for a lot of people. And if we take away insurance coverage, if we take away reimbursement rates for that service, it's going to inherently be less accessible to people moving forward.
Okay, this is another question from a viewer. This is Julie Elizabeth on Facebook, post-traumatic growth. How do we get there?
I'm going to start on this one. We can't even get there yet because the trauma is not over. And I think that's a really tough thing, is that we're still moving through this. And what we know about things like resiliency and post-traumatic growth is that the people who bounce back really quickly and move on in their lives aren't necessarily the ones that are better off in the long term. It's often those who do go through a period of cognitive, emotional struggle. They allow themselves to move through the challenge in the short term, do tend to be better off in the long term. And so I think this idea of post-traumatic growth is really important, and we're going to need to get there. But what people need to do right now is survive and cope with their current circumstances. And we'll revisit that conversation of post-traumatic growth once we're actually in that space. However, there's some things that we can do now, and, making meaning in our lives and memorializing the people we've lost, dedicating your health to other people, spreading awareness. Yes, wearing a mask, getting vaccinated, supporting your frontline workers, your local public health and medical workers, advocating for justice in these systems, and really asking yourself, how do you want to show up differently in your life and the lives of others during a period of trauma?
And I would add to that, this kind of ties back into the question that we were just talking about what we can do to cope with this. And healthy lifestyles is something that is important for mental health even before the pandemic. It's become, healthy lifestyle habits are even more important during the pandemic, and they're going to continue to be important post-pandemic. So, good self-care, making sure you're getting enough sleep, good nutrition, exercise, socialization, trying not to turn to drugs and alcohol. And, to some extent, we've probably gone in the other direction, especially in the early days of the pandemic. And hopefully some people are now kind of, the pendulum is swinging back a little bit, and they're maybe trying to clean that up. But I think that, those healthy lifestyle habits are going to continue to be important post-pandemic as well.
To chime in briefly, if I could.
Go ahead.
With respect to self-care, I just want to speak about that just for a moment. I'd like folks to understand that self-care, if you have the means, should also include your everyday habits, like making sure you make all your medical appointments if you can, visiting your gynecologist, visiting your primary care physician, being able to afford the foundational things. I think oftentimes when folks hear self-care, they go to like extra things like vacations and whatnot. Lots of groups of people can't really afford anything but the essentials. I hope that you are able to make those essentials, maintaining your physical health and mental health. And if you have the means afterwards, then maybe go for the splurges like vacations, massages, and things of that nature.
Anyone else? Well, I know a number of teachers, and they seem to have gone through an interesting last year and a half or so, and they've been especially hit hard with the need to bounce back and forth. They've had remote learning. You've got students who need some additional attention. How do we kind of get them back on track and help them, not lose their senses and not just suddenly all quit?
I think, I have 2 school-age children, and it's been a real struggle. One is, what children don't have the same kind of farsightedness or longsightedness for the future. They look around their current environment and they assess their situations based on what's going on now. And taking away so much for a year from their experiences of what the value of school is and what the payoff of going to school is. To children, the payoff oftentimes isn't the grades, it's the social connections, it's the day in, day out. And that impact has been immeasurable, I think, on children and their ideas about what the future is. I think that, you know, they see their parents out of work, they see their friends' parents out of work, they hear that we're never going to get through this, they hear all these different things, they hear be afraid to touch stuff, wash your hands all the time, you know, don't play ball sports because you can get COVID and bring it home and kill your parents. I traveled with a friend's daughter last summer a bit, and she wouldn't go even outside of, we were traveling by motorhome, and she was afraid to go into gas stations because she had a father who had some health conditions, and she was terrified as a teenage girl. She was terrified that she was going to bring this home and kill her father, literally. And none of us grew up with that as a thought. I never once thought, oh my goodness, I'm going to get the flu and bring it home and kill my grandmother. It just wasn't a thought we had as children. And this kind of consequence, this grave consequence to other people, and the sense of social obligation and the pressure is immense on children. And it will, much like the Great Depression colored a generation, I believe the pandemic will color a generation of children who grew up in it, in terms of their ideas about future and a foreshortened sense of future, and what the future holds for them. I think that there's a lot of, you know, as Tess was saying, trauma that has yet to be fully unfurled.
Okay.
Yeah, Bob, I think I heard two things in your question. One was about teachers and the other was about students. Which one should I start with?
Why don't you start with students? We'll let you do that one.
Okay, so I think, you know, as far as students and children who typically require extra help, so kids who are getting special education services and those kinds of things, what we're seeing, and I've been talking with some of my colleagues who are K through 12 educators and psychologists, and what we're seeing there is that the children who were receiving special services and did some kind of virtual or distance school from home generally fell behind and had a harder time transitioning back to school and needed more support. But the kids who stayed in school, even though they were wearing masks, are not really struggling. They didn't fall behind. So in terms of their academics, for kids who were already behind, virtual learning has had an impact on that. But for kids who are not as far behind, we're not seeing as big of a difference there. I think, you know, we need to do whatever we can to keep kids in school. And that is, you know, socially and academically, it appears to have the most benefits for them.
Do they have you, either one of you or any of you, noticed impacts from masks? I read these comments all the time, and I don't know if there's any validity to that or not.
You know, I think that we don't have a ton of research, but the research that is out there is not suggesting a lot of negative impacts of mask wearing, and that by far, you know, it's much better for kids to be in school wearing masks and be able to socialize than it is for them to be at home with their parents learning virtually. And I'd say that extends to, you know, not just K through 12, but also college students. Lots and lots of college students, especially those who have any different learning differences, would much rather be in face-to-face classrooms. I'm hearing that over and over again. I'm hearing college students say, I've tried this online learning thing for a couple of semesters and I'm going to take a year off because I'm just not getting as much out of it. So I think that what we know is that being in person is much superior to virtual learning.
Well, so I'll jump in on the mask one because that's definitely an area of interest of mine. If you'll notice, none of us are wearing masks. all of us are using video and sharing video. And if one of us was wearing a mask, the impact that we'd be having in terms of facial expressions, response, all of these things has changed. Video itself is less, right? Because you're already trying to figure out, who am I looking at? You know, I spend about 2 hours a day on video, oftentimes in large groups, working through stuff in a variety of capacities. And trying to know when you have a stranger come into a room and trying to even figure out who they're talking to, you know, you'll see them actually look at a corner of their screen like this to figure stuff out. This is not what we experience in the real world. I can tell where everybody's attention is. If the 5 of us were sitting around a table having the same discussion, we would have a lot of cues to that, to who was getting attention and what was really going on. You have eye contact, you have a variety of different nonverbal cues. Facial expression to children and smiling and all of this that they have to interpret from a small area above the face. You know, if you just look at this right now, you really have trouble and you lose a lot of what is going on in terms of whether I'm smiling and how I'm communicating with you. So yeah, I think that the impact long-term is going to be serious. I completely agree that going to school with a mask on is better than staying home a lot of the time. Because I don't think that the kids are able to sync up that social response from the smiles that happen that way, because they don't know if it's directed at them. But I think that the challenges ongoing of masking people versus better social distancing really need to continue to be worked through. I do a lot of my work with patients across a long conference table that's 12 feet long, and I sit at one end and they sit at the other. And I found that to be a lot better than sitting 4 feet away from them with a mask on, in terms of their ability to read what's going on and to understand what I'm saying. And they don't feel nearly as restricted either. And so I prefer to work unmasked at a larger distance than to, and I've worked in a highly COVID enriched, unfortunately, environment. You know, we've had 2 major outbreaks at WDI of COVID, and I've had to deal with circumstances where, you know, we have a lot of cases, and that social distancing is, luckily, along with getting vaccinated, helped me not get infected.
And David, I think those are really good points. I think it demonstrates how complicated this issue is. Yeah. Because another experience that I will share is just having done a lot of graduate student teaching and supervision. So small groups of graduate students, like sometimes about this size, doing a lot of that by Zoom. And now this year doing a lot of that in person with masks on. I think that it's important that you lose some facial expression, but I also think what's happening on Zoom is we're losing a lot of attention. So people are doing a whole lot more multitasking while they're on Zoom. And so when we're in the room together wearing masks, everyone is much, much more present to the conversation that we're currently having. So there's just so many issues here. And right now, I much, much prefer teaching graduate students with masks on in person than I do teaching them by Zoom, because I think that everyone is so much more engaged. And of course, teaching them without not having masks on would be even better, right? But there's just a lot of different complicated issues here in terms of whether the facial expressions are most important or whether people paying attention and not multitasking is most important.
One of the things that I would just tack back onto that, because I do agree with you, Cynthia, but even more so is, you know, a lot of the length of classes I teach too, and a lot of the length of classes is really a construct of the time it takes and the resources it takes to get from point A to point B. So we set it up. And one of the things that perhaps we'll have soon are shorter periods of interaction where it's more purpose driven, because there really isn't a need anymore to have an hour-long class if you really only need 15 minutes to cover a topic, and then people really should be absorbing stuff, and then to have another 15-minute class 3 hours later after people have had time to do the work, because there's no longer the travel constraints that we've had in the past. We haven't really gotten there yet as a society. I'm on the board of a company, and I, our meetings, I do a lot of I supervise a lot of programmers and developers, and I do 5 and 10 minute drop-ins that if it was in person would be impossible. And I would have a meeting with these people once every 2 weeks for 3 hours. And instead it might be multiple times during the day, a 5-minute drop-in to look at where they're at on a particular issue, and then chime out and come back. They just text me and they're like, drop back in when you have time. And we can really move towards that as a society with Zoom. And we couldn't do that before.
Yeah.
Yeah, I just want to quickly reinforce a point that between what both of you said is we do not currently have hard evidence that wearing a mask adversely impacts social and emotional growth. We haven't had enough time to know that answer. So a lot of what we're talking about is theory based on what might impact social and emotional growth. The only evidence we do have at this stage is that wearing a mask protects people from COVID-19. So I do want us to keep that in mind, that we can talk about this all day, but we don't have hard evidence for much else other than that masks are effective in reducing the spread of COVID-19.
I want to circle back around and ask about tips for teachers. Some of them I wouldn't necessarily compare them, maybe they would, but with some of the medical frontline workers. But these are people that have been face to face a lot of different political situations across the state, which are requiring different things. What can we do to help them out, and what are some strategies?
I can start on that one. I think K through 12 educators have been hit incredibly hard by this. And I think really my advice is not so much for teachers. I'm not sure they need our advice. I think that the advice goes to the community and parents, is that we just need to extend them lots and lots of gratitude and realize that they're being impacted really hard and probably right behind healthcare workers in terms of stress from this pandemic. And, they're literally putting their lives at risk every day and being criticized every step of the way. And I think, we should be kind to them. And we need to recognize how stressful this is for them, and the fact that, their livelihood depends on them doing something that they may or may not be comfortable with. And is a lot riskier than what a lot of the rest of us are being asked to do. So I think that, to the extent that they can ignore the drama that adults are engaging in right now and just try to do their jobs. And the other thing to keep in mind too, is that when we have these debates about masks and vaccines in schools, the kids are watching too. And they're watching how we treat the teachers that we disagree with. And I think that we just need to keep in mind that we're role models to the kids. And if we can be kind to the teachers and support them as much as possible, that's the message that we want to be modeling for our kids, and not so much this debate about who's right and who's wrong, but more of let's just be grateful for how hard these folks are working.
Anyone else? Okay.
Anecdotal stories. One thing that I've noticed students say that they like about masks is they don't have to fake smile all day. A lot of students feel pressure to appear excited and happy when they don't feel that way. And that's a lot of relief, knowing that you can feel and look however you choose with the safety of a mask. And I was talking to my neighbor yesterday, and he was giving me a story about not needing to be told to smile or cheer up or things like that. When we're going through such a chaotic time, it's hard to maintain hope when life is chaotic. So there is some freedom from being able to feel and look how you feel and not be criticized for it.
However, I'm going to take some issue with that, because while in the short run they may have that experience, it's unclear whether the social pressures to conform shape things in the long term, and then what happens when you do unmask. So let's say for some reason, because if we go with masking till COVID goes away, we'll be masked permanently. But if we go with masking, I mean, there isn't a cure for COVID right now. There's not a cure in the works. The vaccines have been released. People aren't getting vaccinated. If somehow we get a national mandate to vaccinate, maybe that will change. It's unclear. But otherwise, the rate of COVID infections, we've only really infected 10% to 20% of the population at max in different zones. And so if you go out, and it's been nearly 2 years now, right? So you're really looking at to infect the entire population, you're looking at a very long time before you'd say, well, it's actually worked its way through. And now we know that also people become reinfected, especially with different variants. However, in terms of your thoughts there, while that might make them comfortable in the short run, I don't know whether or not it actually helps them heal and deal with what they need to deal with. And also social smiling and all this, if you go back to a world where you haven't had to social smile for a few years, and then you're, stone-faced because you didn't have to bother, I don't know that that's going to really lead to success for those people. So I would be concerned about them and their ability to perform when masks come off.
I want to.
Sure, and I mean, I think the idea there is being forced to social smile is different than social smiling when you feel happy. That is very much like telling anyone who's sick to appear healthy. And that is just a lot of pressure that one might not need. And so if they don't feel like smiling in those moments, don't. And then the idea is, it isn't about cheering up. It's more about, tell me what's going on if you'd like to. Tell me how you're feeling if you'd like to. This idea that we need to appear happy can create a lot of stress that a lot of students get that they experience throughout the day, and they have what I call 10 o'clocks, where they appear happy all day long, and then they go home and crash and cry, and just because of that pressure to appear happy the entire time. So I get what you're saying, Dr. I hope I'm pronouncing your name correctly.
It's fine, but Martirano. Yeah.
Dr. Martirano is a person who gets their name missaid all the time. I want to make sure I'm clear. Yes, hopefully one day this will change to something more maskless. But anyway, I'm going to stop there. We've been on masks for quite some time.
Let me ask a question that we got from a couple of listeners. One of the things that seems to be happening is our suicide hotline for crisis this year is there's skeleton crews. We've had a couple of questions from people that we're not hearing from people getting back to them in a timely fashion. What's going on there? Julio, you want to jump on that and can we get this fixed?
Sure. Well, so most folks that cover hotlines are volunteers. So that's a really intense job to do in your spare free time, what have you. Thankfully, we're expanding that more and more in about a year and a half. I think July 2022 is what I last read. We're going to have 988, which will replace the traditional line. And so hopefully what that will do is it'll spread the wealth, if you will, of people being able to answer and respond to hotline calls. And if you have time and if you'd like to be a part of something useful, there's lots of ways to volunteer, to be a hotline advocate, either by voice, by text, what have you. So that's going to continuously be a problem considering most of those folks that do it are volunteer based, and that's just a lot of work to take on for free, if you will.
Okay. We had a question earlier from Lisa on getting the message out to consumers, how to use telehealth. They have a list of providers on the website that involves the Wyoming Telehealth Consortium, but trying to find providers, is there any suggestion for how people can find providers who will do telehealth?
Sure. I mean, if you can look on Psychology Today, for example, there are pretty ample resources there. The Wyoming Telehealth SIG, I can put their contact information up there as well. And there's different ways too. And plus, reaching out to any counseling center, they can probably put you in touch with local providers that offer telehealth and in-person services too.
And one other telehealth question, I guess this is a big topic, but what do you think that are the barriers to patients receiving mental health care in their communities? What do you think are going to be the biggest barriers in the future?
I think it's the access to financially feasible services. Going back to what I suggested earlier, is that telehealth is not covered by a lot of insurance. And we have one of the highest rates in the nation of out-of-pocket spending for mental health services. The state of Wyoming does. And so if you add on top of that a telehealth service isn't covered by your insurance, you're paying even more. And so I do think the worst thing I can think of is that after the pandemic, when and if we get there, we go back to not reimbursing for telehealth services. We go back to saying in-person is the only option, in-person is the norm. A lot of people are going to lose access to services that they otherwise had during this time.
Are we having mental health providers dropping out or being impacted by all of this and the surge in needs for services? And how are we prepared to handle that as a state if that in fact is happening?
No, I mean, I haven't seen any of that happening. I haven't seen a decline in mental health. I've seen a bunch of people going into mental health. I have a crop of nurse practitioner students who one is like 30 hours away from finishing, but they're all in various, I usually have 2 or 3 graduating a year. So we're producing people who want to go into mental health. We still lack at the psychiatrist level. Wyoming has usually between 15 and 17 psychiatrists across the entire state. So we don't have in-state psychiatric providers. One of the things that Tess was saying earlier about Medicaid expansion, and believe me, I'm all for getting more money out there, is that Medicaid doesn't really pay high enough that it's easy to recruit more providers, especially people from out of state. So I think that until we actually see better rates to encourage people to do the work, especially at the counseling level, we're going to continue to have a deficit in that area, because many of the prescribers I know don't accept Medicaid. Getting into an outpatient Medicaid supported practice, and the community health centers are already full in terms of their outpatient prescribers, and they're usually using other subsidies to entice. So they're collecting on that Medicaid, but they're actually losing money on their providers who they're using Medicaid for, and they're paying them a premium above that cost in order to get them to actually prescribe. So Medicaid doesn't pay enough. It would be nice if it did, but it's not competitive. I'm not arguing. I don't want to get into a thing about salaries. I can just tell you factually, it's not paying enough to get people to take Medicaid. And so most of the prescribers in this state, psychiatric prescribers, don't take Medicaid. And unless they're in a setting, like if they're in a private practice, they don't take Medicaid. And so the only people who do are the community health centers, and they're really siphoning dollars from other silos to help subsidize those costs. And so we have to look at what the real cost is and change it. And again, Tess earlier alluded to talk to legislators. That really is it. There just isn't enough money to entice people to do that work.
And just real quickly, we may not be seeing mental health providers leaving in masses from our field, but I don't want to minimize the impact, because we are busy and we are full. And if you look for private practice, if you're looking for someone with certain specialty, you may not have that option anymore. And so lots and lots of providers, community health agencies, counseling centers, hospitals, private practice, we are full and we are busy. So we may not be leaving, but at some point you push people over the edge and there's no more services. There's no more available.
Well, and I'll just add to that how stressed mental health professionals are. So, not only are they kind of seeing as many clients as they possibly can, and they're concerned and stressed about their long wait lists, but also they're also having their own stressors in their own family life and their own sick family members and lack of childcare because someone has to quarantine. And so they're stressed too. And that's really, causing a lot of extra burden for them as well. The other thing I'll just say real quickly about insurance is, it's not just Medicaid, but all of the insurance companies that we use for mental health services are often underpaying for mental health services. So this is a really big problem in terms of getting more people to come into mental health, is that we're not reimbursing at the same rates that we are for physical health.
All right, I want to wrap up. Who has something they would like to say in 30 seconds? Julio, what do you have for us that you wanted to say and didn't get a chance to?
I just continue to promote mental health services. This is important in physical health services. Continue to show compassion, and Black Lives Matter. Thanks.
David?
Stop smoking, exercise, be kind to other people, get vaccinated, and make wise choices about when you socialize. And if you don't feel well, don't go anywhere. If you've got a runny nose, stay home for now, because even if you don't have COVID and you give somebody else a cold, they're going to get tested. Everybody else is going to get tested. It creates mass panic. So if you can avoid going places if you don't feel well, and wash your hands. Please wash your hands. Wear a mask in circumstances where it's appropriate, or where it's mandated. Wear it wherever you want. But wash your hands, please, a lot. Wash your hands.
Tess?
I think I would say COVID has not impacted everybody equally, and we sometimes lose that in the conversation. And that, it's especially for people who are most at risk for COVID, the elderly, the chronically ill, the marginalized. So when we don't wear a mask, when we don't get a vaccine, when we say this is fine and it's all going to be okay, if we're not considering those who are most likely to be impacted, we're doing a disservice to our community.
Cynthia, last word.
Well, I don't want to undermine any of what we've just said, because this is all really important, but I also think that people are resilient and that the kids are going to be okay.
Well, thanks so much to all of you for taking time to visit with us. Those of you who are coming in late, this will be available forever, probably on the Facebook site, so you can go back and watch it all. And so again, thanks to all of our participants for this excellent discussion. We will be having another one of these discussions coming up later in the month of October. We're going to deal with 2 or 3 of these town halls. So hopefully you'll join us. You can get more information on Wyoming Public Media's Neighbor to Neighbor resource page. Have a great afternoon, everyone, and thank you.